Ladies and gentlemen, good afternoon, good evening, and I hope you're all well. We're glad to have you on this expert chat, and I'm hoping that some of you can probably just type in the chat where you're joining us from, and let us get to know who you are and what your expectations are from this specific chat that we're having. So this comes in as an official welcome to the conversation, and allow me to begin by introducing Nairobi. Nairobi is a Kenyan nonprofit that uses ICT to deliver socioeconomic transformation for communities in under-resourced areas. And Nairobi simply has a wide array of offering that promotes high-impact careers and solutions in the tech space through technology, training, and innovation, as well as building the acumen of various community members, cross-border exchange of talent, and opening opportunities for various beneficiaries that we work with. And since its inception, say about 2 decades ago, and even slightly above that, the organization has been able to significantly impact the lives of over 100,000 individuals, and it continues to make tech as accessible and as life-changing as possible among vulnerable people to ensure that they're able to equally participate in the current digital era. And currently we are running the Diverse Vibes digital campaign, which is very critical when it comes to discussing sexual and reproductive health rights of individuals in society. And it's simply a youth-centered and youth-led digital campaign by the Nairobi's Trust team. And we are delivering this particular campaign as part of the Right Here, Right Now 2 program, which seeks to ensure that young people in all their respective diversities, and we're talking about diversities, we're talking about heterosexuals, we're talking about queer people, we're talking about everybody at the same time, being able to enjoy their sexual and reproductive health rights in gender just society. So the key here is gender just society, really, and being able to make decisions from a very informed standpoint. And our focus as the Diverse Vibes team is to have honest, assorted conversations around SRHR information and education, as well as gender justice, and what these two particular aspects mean for society with a particular lens on young people. With that said, this specific expert chat serves as our first dialogue-based intervention that sets the pace for conversations around sexual health and reproductive health. So ladies and gentlemen, with that little background, it's a pleasure to have you all on this call, and we're looking forward to a very engaging session, a very informing session, and a session that just allows young people to interact with our specific guests and get to know who they are, what they do, and what this conversation means for how we take charge of ourselves within gender just societies. So let's get to knowing who our speakers are. Maybe let's begin with Lisa Mary Ann, who's on the call. Lisa, please introduce yourself to our audience and give us a feel of the work you do around SRHR.
Thank you so much, Laureate. Let me just switch on my video real quick. Hello, everyone. How are you? Thank you for this invitation. Nairobi, I'm really honored. My name is Lisa Miriam Mwangi, and I am a youth advocate around issues surrounding sexual and reproductive health, and align bold rights bits, because that is my forte, the rights bits especially, and issues around gender justice and social justice for adolescent girls and young women. I am the team lead of a community-based organization known as Mothers and Daughters Care Initiative, where we support adolescent girls and young women to be able to make informed decisions, as well as be meaningfully engaged in issues around policy advocacy and decision-making in general. Thank you so much, Laureate.
Thank you very much, Lisa. It's a pleasure to have you on this call today, and we are looking forward to engaging you in this conversation entirely. Our second speaker is Dolaman Fatinato. Dolaman, please introduce yourself to our audience today and give us a feel of what you do in the SRHR space.
Yeah, thank you so much, Lorit. As you put, my name is Dolaman Fatinato, and I work at the Center for the Study of Adolescence as a youth coordinator, where I support implementation of various programs targeting adolescent and young people in regards to sexual reproductive health and rights. Thank you.
Fantastic. Thank you very much, Dolaman, and we are very happy to have you on board as well. So I can see several people joining in, and this conversation looks like it's about to be one of the best conversations around SRHR, really. And at this juncture, I think I just want to get into a few ground rules. Ladies and gentlemen, please make sure that your mic is constantly muted through this call so that we can be able to have a seamless flow throughout this conversation until 5 p.m. Secondly is with regard to digital engagement. Feel free to tweet, comment, share, and tag Nairobits Trust, and right here, right now too, CSA, and you can also tag Lisa as well as Dolaman to just get to engage them digitally as well. And yeah, I think that's mostly it. If you need to ask a question somewhere in between, we'll open up a question and answer session where you can feel free to raise your hand and engage us or type in the chat box as much as you can. Somewhere in between, I might call on my colleague Alex to share a few instructions on digital engagement, but for now, I think that works for us. So let's begin. And as we mentioned in the beginning of this expert chat, the Diverse Vibes digital campaign has young people at the center of conversations, considering the fact that, you know, right now, young people tend to lack access to accurate SRHR information and platforms to engage on this very same issue. So allow me to begin with Dolaman. Considering your expertise as a youth coordinator within the SRHR space, what is sexual health and what does this mean for young people?
Yeah, thank you, Lorit. Sexual health is basically the general well-being in relation to reproductive health, in relation to your reproductive system. When we are talking about sexual health, first of all, we start by defining what is health, and we know this is the state of well-being and not merely the absence of disease. So we bring that back to sexual, where we're now bringing the reproductive system of a person, and this does not just begin and ends within the reproductive system of boys and girls, of men and women, and people of all diversities. It also extends to mental, how people relate, how they socialize with each other. Thank you.
Okay, thank you very much, Dolaman. I think one very interesting thing that came up there is it's well-being minus the absence, and it's not necessarily the absence of disease, and that's very important to know. And this brings in the whole idea of decision-making and any other kind of engagements as well. Lisa, could you also touch on the same? From where you sit, what do you perceive of sexual health and what exactly it means for young people?
Thank you so much, Lorit. I concur with Dolaman's sentiments on what sexual health means. And I would also like to add that sexual health is not necessarily limited to, to your sexual organs, but in recent studies and research, it is also associated to your mental health and well-being. It is associated to other key aspects of your life, such as your social well-being, your economic well-being as well. So we are viewing sexual health from a comprehensive perspective, as well as an intersectional perspective, because sexual health issues are not usually limited, to physical issues, but other issues that arise in relation to gender justice and all. So yes, I do concur with Dolaman, and I would encourage us to view it from a more comprehensive perspective. Yeah.
All right, thank you very much for being able to set the pace on what exactly sexual health is and what it really means for young people, and for bringing up the fact that it's not necessarily about health only, but even about decision making, as well as the intersectionality of different issues and how they actively affect how young people make decisions about their bodies, their reproductive organs, and even just how they interact with other people within society. Now, over time, we have seen very many stakeholders emphasize on sustainable development goals and their role in closing any kind of inequality gaps that exist in society. And as we know, the sexual health and reproductive rights sector itself is filled with several inequalities. But at the same time, under this respective SDG, that is 3 in particular, that discusses good health and well-being, one of the main targets is that by 2030, we should ensure universal access to sexual and reproductive healthcare services, including family planning, information and education, and the introduction of reproductive health into national strategies and programs. So I just want to bring you back in, Lisa, and to listen to what your perspective is on the contribution of sexual health to good health and well-being within societies, not only for young people, but as well as women and girls, and to just make sure we're able to get to know what really is the contribution of sexual health and good and well-being to this whole conversation. Yeah.
Okay, thank you so much, Lurit. The contribution of sexual health to the overall well-being of adolescent girls and young women and young people in general basically is ensuring that first, people are able to access accurate and age-appropriate information with regards to their SRH, as well as the rights aspect of it, ensuring that young people have access to quality and affordable services, and not just services alone, but also the commodities, because the services can be there, but commodities might be lacking. So ensuring that there's also a conversation around affordability and accessibility of commodities, ensuring that, the sexual and reproductive health rights space is a safe space for all women and girls in our different communities to be able to accommodate what we would refer to as vulnerable groups or the marginalized groups within the space. This include key populations where we have sex workers, as well as the LGBTIQ community, persons living with disabilities, PLHIV, just ensuring that it is a very inclusive space, and also, relating it directly to our daily lives and our daily experiences, because you do realize that when young people wake up, the first thing they think about is about, what will I eat today? Will I get a job? Where will I sleep? How is my education going around? So ensuring that we are able to to sort of like structure the SRHR conversation to fit into their daily lives and their daily thoughts. That way it becomes more meaningful and more impactful for them. So I can just quickly break it down into, you know, how it might affect the political, social, and economic lives of adolescent girls and young women. So politically, just ensuring that issues of gender justice are being upheld, or rather there are provisions for it. Our constitution provides for the 2/3 representation, just in decision making or in legislation per se. So this is one of those things that affects our political lives, ensuring that there's adequate representation for women and girls so that their issues are prioritized in legislation as well as in budget making at both national and county levels. And then on issues of social, ensuring that women and girls are protected from violence, from harmful cultural practices, and they're able to access services, you know, in a timely manner. And then on the economical aspect, just ensuring that, you know, young people and women and girls are supported to be at their optimum health. So that is their mental well-being and their physical well-being as well, to ensure that they become or rather they participate meaningfully in the community. So what does this mean? This goes back to the conversation on availability of contraception, availability, or rather freedom to be able to make decisions on when you want to have children, who you want to have children with, you know, so that you're not forced to be a teen mom, but you're given an option of maybe thinking around a safe abortion should that happen to you, just so that your education is not cut off. You're able to fully sorry, I don't know where the noise is coming from. Anyway, you're able to you know, to improve on your skill sets, you know, build on your potential, and that way you can meaningfully contribute to the country's economy and improve your life in a way that, you know, you're able to reduce poverty either from your generation, your family, and even your future. I hope I've not taken so much time, but I felt that would be a comprehensive summary of what SRHR would mean to women and young people. Yeah.
Amazing. I think, Lisa, you've been able to capture that very well. Before I just echo your sentiments, ladies and gentlemen, I can see the chat booming. Please keep conversing with us and ask as many questions as you have in the process. And just to get back to digital engagement, share as many nuggets as possible from this webinar on social media. Tag Nairobi's Trust, CSA Kenya, and use the hashtag diverse vibes. And Alex, maybe you can just share a few of the people we can tag in this chat as we keep going. So maybe just to go back and echo what Lisa has said. Lisa, you've really emphasized on accessibility. You've also emphasized on affordability of SRHR services and what they mean for how people make decisions about their respective bodies and how they even just make informed decisions and not just hurried decisions. And also you've talked about something very critical, safety and inclusion. Safety in such a way that people need to be safe at all times in terms of how they engage, how they discuss things in different platforms, and even just in terms of relations. Are we practicing things that are safe for the population? These are things that we also need to ask ourselves every now and then. And another thing is about safety of spaces. They need to be able to accommodate vulnerable and marginalized groups at all times. And this is very well intertwined with affordability and accessibility. Again, something else you've really talked about is meaningful participation, and how meaningful participation is heavily reliant on just how people are able to access different services that are actually affordable within the economic society right now. And all these things feed into the social, political, and economic environment. You've been able to echo that very well. Now let's quickly transition into the question on human rights. And Dolaman, I really want to bring you in here. What are some of the sexual health and reproductive rights, and what is their status in Kenya right now? Hello, Dolaman, were you able to capture that?
Hi, yeah, I got your question, Lurit. Sorry, I was unable to unmute, but I hope you can hear me now. And you're asking what's the status of sexual reproductive health in Kenya. And just to begin, I was saying that my colleague Mariana has provided a very proper landscape of what sexual reproductive health is and what it means in broad aspects. When we look into the legal status or landscape when it comes to legalities, that we just begin with our constitution. And I think you highlighted a bit earlier that our constitution guarantees us as citizens of Kenya the highest status, the highest quality, access to high quality Yes, our constitution guarantees us access to high quality healthcare, including reproductive health. And this is stated under Article 43. The fact that it goes to emphasize on reproductive health, it means that it is a real issue that probably those drafters of the constitution saw it important to have it emphasized because it was probably being sidelined. So our constitution guarantees everyone access to high quality healthcare, and including reproductive health. To mention other few things that are relating to the legal status on sexual reproductive health is that we have other many acts, we have other many constitutional provisions or legal provisions that guarantees access to high quality standards of healthcare, including reproductive health, and that includes Sexual Offences Act that provides landscape or framework for protecting people from sexual and gender-based violence. It provides guide on how such cases can be handled, how survivors can be protected, and how they can be assisted to access justice. Now let's come into how the practicality of that is where we normally face a lot of challenges, because we have the law, we have the acts that are providing, stating how things should be in relation to sexual reproductive health. However, we also have policies at the ministerial level where the Ministry of Health and other key stakeholders have developed good policies that guide how those rights can be realized. But when it comes to practicality of that is when we face a lot of challenges, because we don't get enough resource allocation for the implementation of those policies. We don't get enough political goodwill, because when we are talking about issues of sexual reproductive health and rights, there are some do say that very sensitive issues, and indeed, in some extents, they're sensitive but very important issues that should be discussed. We have a lot of cultural and religious beliefs that hinder us from fully allowing people to enjoy their reproductive health rights. We have individuals who work at or who are in the position where they're supposed to implement these laws or to implement these rights, because it's also a human right when you look at it from the global perspective. But their personal beliefs and cultural beliefs and religious beliefs tend to hinder the progress, tend to come before what supposed to be done. Let's talk about something like provision of sexuality information to adolescents and young people. You find it that the country has committed to a number of international commitments, has made a number of international commitments, but the implementation of that is not being done because we believe that some people believe that providing sexuality education or information to adolescent and young people is encouraging proximity, which is exactly the opposite of that. Sexuality information tends to empower young people and help them make informed decisions. When we come to resource allocation, you find that we have a devolved function. Health is a devolved function in our country, but resource allocation to sexual reproductive health and things like provision of wide range of contraceptives in the health facility, they're not there. They're not there because resources are not allocated, because some people see it not as a priority, yet it's a key priority. It's only that many people shy away from talking about it, and they put it under the bed. They put conversations around sexuality under the bed, which shouldn't be the case. Thank you.
Okay, fantastic. Thank you very much, Dolaman, for giving us a glimpse on what sexual and reproductive health rights look like in the Kenyan context and in the general SRHR space at large. It's very clear from your sentiments that there are policies, there are different documentations on the same, there are different interventions on sexual and reproductive health. And there are very many interventions as well, trying to ensure that people are able to participate on the same. However, there are notable challenges when it comes to the implementation of these issues. So the practical side has a very huge gap. And so people are not able to participate in this whole conversation, and as well as even just take charge of their sexual and reproductive health. At the same time, from your conversation, I'm able to pick up 3 critical principles that are very important when it comes to sexual and reproductive health rights, and that's the quality of care, accountability of people, just decision makers and any kind of stakeholders within the same space, as well as equity in access. These 3 principles are very important in this space to ensure that sexual and reproductive health rights are well captured, well engaged with, well implemented, and are able to also just ensure that the public is able to participate in the same space as much as any other kind of stakeholders in society. And then the fact that health is a devolved function has got to be the reason why it should be working in the first place. However, there are notable challenges when it comes to even just resources, even just capacity, and there are several other inequality gaps that tend to prevent the ability for people to engage actively in this respective space. Now, I know this is something that we should have even just talked about in the beginning, but I still want to bring it home a bit closer, considering that we're engaging with very many youth, and I can still see so many coming in the process. And Lisa and Dolaman, at this juncture, I think it would be very, very important for you to just give us an idea of what your experiences have been with young people and sexual health. And maybe you can give us stories of different SRHR scenarios that have come in, and then we can just engage the youth a little bit and get to hear their experiences as well, and maybe a few questions that they have, and then we get back to the second part of this conversation. So Lisa, maybe you can begin with that section.
Thank you so much, Lorette. Wow, I feel like that question is so broad, but basically my experience around advocacy and engaging young people to be champions and advocates of their own sexual and reproductive health rights has mostly been positive, but as you've said, we have notable challenges, and most of these challenges are mostly systemic challenges, some of which they're really, really difficult to penetrate or address. And sometimes when you feel or think you're making progress, then things come up and they just take you really, really behind. But what I can say is that from my experience working with adolescents, girls, and young women, especially in peri-urban communities and grassroots communities, because those are my, the areas where I really work in, has been really progressive. Let me just give an example, since you've asked us to share examples. So for the longest time, I've been working and supporting a group of young people in Narok County, and we were able to form a technical working group, and we lobbied for them to be able to be, like sort of like the what are they called, to play an oversight role on the RH department of Narok County, and their engagement has really been positive at the county, and they have been able to, through continuous engagement, we've been able to capacity build them and give them relevant tools and skills to be able to grow a community movement which supports the technical working group in providing that kind of oversight at the reproductive health department of the county government. However, there have been notable challenges such as socio-cultural limitations, especially in a community which is quite conservative, quite reserved, whereby conversations around sexual and reproductive health, they're really put under the rug. No one really wants to come forth, especially considering that this is a county which leads with the highest rates of teen pregnancies in Kenya, at 40%. So, those are some of the challenges that we have been experiencing. So you find that young people really want to talk about it. Young people are making, conscious and intentional efforts in advocacy, in ensuring that, they cascade the kind of information we give them back to their communities. They even go to radio stations and speak in mud, just trying to, to challenge the county government to be able to provide them with affordable services, as well as provision of commodities in the services. So some of the gains that we were able to accomplish there is the level 4 hospital in the county did put up a youth-friendly service unit, which was a win. Unfortunately, the unit is not functional. And the excuse they gave, actually it's being used as a store, and young people, the excuse they gave is that young people are not accessing the youth-friendly center. And also they said that they opted for integration of the services within the normal and the usual, services that are being offered at the facility. So you see, we are making we are going 5 steps ahead, and then the county takes us 10 steps behind. Then last year, the task force, alongside with some stakeholders who are partners, we were able to develop or rather initiate the development of a policy around prioritizing SRHR services and information at PHC level in Narok County. So PHC level is basically the primary healthcare level. These are facilities at level 1, 2, and 3. So the dispensaries, you know, the local clinic around in the community. And it was a really good document, and we were able to even resource mobilize internationally with this document. However, when we finished all the processes, and we even did a validation meeting with the county government. So when we were getting to the point of presenting it to the CEC and then hoping that the next steps would be politicizing it, you know. So some of the feedback we got was like, you know what, this is an election year. This is not a priority, unfortunately. The document is really good, and it will empower women and girls to be able to access SRHR services, you know, at the mashinani level, that's the PHC facilities. But we cannot bring it forward, you know, to the county assembly and get it passed. So what we are going to do as a department is we are going to adapt it. You know, that sounds a bit nice. However, there is no evidence of this document being adopted, because even when they were doing the annual development plan that was at the beginning of the year, they had committed to ensuring that some of the recommendations in this document would be included. And on following up, they were not, again, with the excuse of, this is an electioneering year, we're just doing things, you know, mbio mbio, but we are going to adopt it officially when the new government comes in and when we're doing the CIDP plans for the next 5 years of the county. So you see, from this experience, it clearly shows you that young people want to be at the front line of, you know, influencing decision-making when it comes to their bodies and their rights, especially their sexual and reproductive health rights. They are really courageous, confident, and bold, you know, to even challenge duty bearers around these issues. However, the little steps, or rather the progress that they make, always faces a backlog of challenges that sometimes are really hard to penetrate, especially when you're dealing with duty bearers. But the wins is the conversation is getting normalized at the grassroots level, and they recently were able, or rather we recently were able to sort of like come up with community working groups. Now these community working groups are the elders, you know, at the community level, who most of the times are the ones who sort of like dictate what kind of information is being shared, you know, especially in such a conservative community. So yeah, that is one of the experiences that I felt would really challenge some of the young people, the 90+ young people who are here, not to be fearless despite the challenges that they face. And as we say, a luta continua. We are not giving up. Yeah, thank you.
Great. Thank you very much, Lisa, for that experience. It's very interesting to engage with the fact that young people are indeed at the front line of championing sexual health and reproductive rights, and they are really willing to be able to engage. So young people, I'm throwing back this question to you that Lisa just said. Are you young? Are you courageous? Are you bold and confident enough to take charge of your sexual and reproductive health rights, as well as participate in areas that require you to? Maybe you can give us that feedback, you know. And young people in the chat right now, please share your questions as much as possible, because we're just about to open up the Q&A segment and get to hear what the youth have to say. My youth, msisahau kuweka your questions into the comment section na mtuambie what you have to say. Dollarman, I'm coming back to you. What has your experience been like? And really, has there been any kind of wins in the process? Let us know.
Yeah, thank you, Lorit. And I'll just share a few stories briefly. One would be touching on services, another one will touch on information, one will touch on participation of young people, and the last one will touch on our culture, how we view, how parents view sexual reproductive health, and how sometimes they're caught within a hard place and a rock. So I'll start with this experience where we ever organized a community engagement with young mothers. When I say young mothers, it means these young women who have given birth at an age that is probably below the age of 18 years, or those who got pregnant as teenagers. So we've ever organized a conversation with them, and to our surprise, how things were is that during the conversation, when they're just sharing the experiences, how the pregnancy period was, how they went to the health facility, how they delivered, and how they were treated, it actually occurred that some of them did not know existence of some methods of contraception, or how to even use some methods of contraception. I think the only method that was widely known to them is the male condom and the pills. Yet we have up to close to 15, 17 methods of contraception. So they were surprised that we do have these wide range methods of contraceptions, but they are not able to utilize. So the only method that is known to them is condom and the pills, which sometimes it doesn't work for everyone. So that was one of the experiences that I found that we really need to do a lot of work in empowering young people with this information on sexual reproductive health. I mean, for a young mother who has already gone through antenatal and postnatal, not being aware of methods of contraception that exist, it really tells a lot about the gap that exists in our health system. For a young mother who has gone through a health facility and delivered, at least the minimum that you'd expect is that this young girl, after giving birth, was informed or sensitized about the existing methods of contraception and how they can put the methods into use so that when they can have the next kid when they are ready. Yeah. My next story is on service. I ever worked as an attaché in one of the county hospitals here in Nairobi, and there was this night that I came from work and I went for a night shift. And around 6 a.m, when I'm trying to now check out, there is a young girl about 14, 15 years old. We saw that girl had approached the emergency area and sat on the benches. So together with the nurse, we were wondering, okay, what would you be doing here in the health facility? This early morning, you are alone, you are a very young girl. So one of the nurses approached and asked what's the problem. The girl looked sad and devastated or confused. So when the girl was asked what would be the problem, she said that I'm bleeding. I've been bleeding for some time. Wow, so we are all perplexed or confused what would be happening. We continuously ask the girl what could have happened, how are you feeling? The girl remained mum, could not talk, but just say that I'm bleeding, I've been bleeding for some time. And my sister has told me, my elder sister has told me to come here at the hospital, to just come here at the hospital, didn't tell me anything. Only to discover later that this young girl was pregnant. And the elder sister knew that she was pregnant, went and bought abortion pills and gave to the girl without informing her that these are abortion pills, and then sent her to the health facility alone very early in the morning. So I think that touches on how access to reproductive health care is still a big issue, because you think this elder sister should have accompanied the girl or should have taken the girl initially from the first step of discovering that she's pregnant, and have a conversation with the girl about the pregnancy, what should be taken. Because when you look at this young girl, she wasn't aware that she's pregnant. It's only that the girl, the elder sister saw some signs in that girl, took the girl to do a pregnancy test without informing her, then got abortion pills and gave her and sent her to the health facility alone. So that shows kind of risk that this girl was being put under, and the difficulties, and the need to now destigmatize access to quality sexual reproductive health. I'd got to share another one on culture. I've also had an opportunity to have a conversation with adolescents and young mothers together, to have adolescents and parents in the same room to talk about sexual reproductive health. And there was this young boy at a Form 2 boy who asked her parents, "What would you do if I impregnated a girl?" Everyone in the room was surprised. Yet during the conversation, they were opposed to girls being given, or young people accessing contraceptions. This was a key eye-opener to all persons who were in the room, including parents, and some parents were religious leaders. They discovered that indeed, if a young person is sexually active, they need and have a right to access. It's actually more important or more safe if they access methods of contraception. I'll move to the last one quickly because of time, is on meaningful youth participation. In Nairobi, we've had an opportunity to bring policy makers in the health department some years back together with the young people to look at the challenges that are facing Nairobi, they're facing young people in Nairobi in relation to sexual reproductive health. And during the process, we had policymakers saying that, meaning this interaction that we've had with young people has been an eye-opener to having an opportunity to understand the needs of young people. And so we came together, developed our framework, which was, if you look at the interventions that are being proposed inside, they are responsive to the needs of young people. So those have been my experience with young people. We've had negative ones and positive ones. Thank you, Lorit.
Wow, I think it's amazing to just get to learn practical experiences that are going on out there with regard to sexual health and reproductive rights. And I think it's very interesting to also have the youth in the group, in the chat right now, getting the chance to just understand these various experiences and maybe relate with some of them as well. Dolaman and Lisa, you've been very informative for this specific segment of the chat. And now I just want to move to the quick Q&A part. And we have 10 minutes, so I might have to ask you to just reduce a bit of time on responding to this respective questions. But Dolaman, there's a specific question for you from Robert, who is part of the students at Nairobi. He asks, under Article 43, as you mentioned, there are laws that govern sexual harassment. So are there platforms where such cases are listened to, especially from men who at some point fear to report such cases? So maybe Dolaman, as you think about that, let me just ask the second question, and I'll direct this to Lisa. Viona Kageha asks, are adolescents or anyone seeking SRH services and information being protected from medical practitioners who breach privacy of those seeking those services? And yeah, I think maybe you can pick those two questions and then I can ask one last rejoiner before we close the segment. Thank you. Thank you,
Lorit. If I got it correct, the question is on men or boys engagement. Yes. If there are legal provisions that protect boys.
Yes, are they allowed
answer to that is very quick, that Article 43 talks about all persons and does not discriminate or talk about women and girls alone. So when you're talking about access to high quality standards of healthcare, including reproductive health, it talks about everyone and not just not just girls and women. It extends to everyone who identifies as they want to identify, whether men, boys, lesbian or gay. Yeah, it talks about everyone.
All right, Lisa, maybe you can take the second question.
Thank you, Lurid, and thank you, Viona, if I got it right. So she was asking whether young people can be protected from service providers who breach their privacy. And the answer is yes, they can be protected from such, because the Constitution does provide for in Article 35, on the section for access to information, I think section 2 of it usually talks around someone having the right to be corrected and someone being protected from defamation or deletion of untrue and misleading information that affects that person. So service providers who go, publicizing your personal information, or even using that information against you, are going against the Constitution, and you can be able to sue them for defamation. Unfortunately, suing someone in Kenya, oh my God, it's so expensive. It's such a, it's a path that most of us really never want to go through. However, the best way I would encourage you to do is report them to the hospital management for action taking, because it also goes against the policies of service providers and all medics to be sharing information, because all this information is supposed to be confidential. So the easiest way would be to report them to the hospital management, and it will be followed up upon. I don't know whether reporting to a police person would be effective, or they would make matters worse, especially because this was a private issue and you really wanted it to be kept private. So that sometimes might not go well, especially if the issue is around access to contraceptive or access to safe abortion services, which, the police are in the opposition around that. Yeah. I hope that is helpful, Viona.
Thank you very much, Lisa and Dolaman. I hope they've been able to answer your questions as much as possible. And ladies and gentlemen, I hope you're really engaging us digitally and just tagging hashtag right here, right now to hashtag WeAreBits, hashtag diverse vibes. And don't forget to tag us at NairoBits Trust and share your thoughts and opinions about what this conversation has been like. Feel free to also share your questions as well, and we can continue to pick up this conversation as we keep conversing. So maybe just 2 last questions before we finalize, and I'm going to give you guys 30 seconds each to just respond so that we can end this conversation at the top of the hour. This is specifically for Dolaman, from Eric, who asks, are there any unfiltered sex education programs in schools for young adolescents and teens? And Lisa, I think another question that I might as well just bring up and ask from your side is, how about protection from service providers like abortion to have abortion? And okay, things like abortion, really. I think I'm going to rephrase this question a little bit. Things like abortion, how safe are we from such issues? And is it important to go for monthly checkups that are related to sexual health? So 30 seconds each, my dear panelists, please, let's respond to the youth and give them a few informed answers on the same. Thank you.
Thank you so much, Lurid. On the unfiltered sexual or sex education, that we have a school health policy in Kenya that talks about provision of sexuality, age-appropriate sexuality information for adolescent girls, or for students or adolescent and young people in school. So that provides the guidance. And when we talk about age-appropriate sexuality information, it means that this content has been designed based on evidence or research to fit to a particular age. So all information has been capped and say that from age 8 to 10, this is the amount of content of sexuality information that they can receive and is appropriate to the current age that they are. And other content have been curated and made suitable for a particular age. And we even have international technical guidance on how that can be done. However, implementation is where we're still a bit shaky, and cultural and religious barriers are hindering that implementation. Thank you.
Okay, thank you very much, Dolaman. Lisa, you can go ahead and answer the other question.
Yes, so I believe the question was around access to safe abortion and how service providers approach it. So with the reinstated standard and guidelines around safe abortion and also Article 26.4, people, or rather women, can access safe and legal abortion. However, there are restrictions that come with it, and usually these restrictions, you mostly find them in public facilities. So they will offer you post-abortion care, but they will not offer you safe and legal abortion, from inception, or rather from when you express the need. However, we do have hotlines where they can always refer you to private facilities where you can get safe and legal abortion, as long as the service provider is able to, sort of like make a judgment that you need it. And such hotlines are like Nena na Binti and Auntie Jane, and they are absolutely confidential, and you can be sure that your information is not going to leak out. And after you get that service, they will ensure that you also get into a contraceptive method, and a long-term one, preferably, just to avoid another incident of abortion, of you having to procure an abortion. I hope I answered the question, Lurit. I don't know whether there was a part B, but yeah.
Yes, I believe that you have been able to answer that question. The other part of the question was simply, is it important to go for monthly checkups?
Oh, yes.
Related to sexual health, yeah.
Yes, it is very important to, especially for women, to go oftenly seek the services of a gynecologist. And if you cannot afford a gynecologist, because that is also expensive, we do have professional gynecologists in public facilities. And you can be able to get affordable services there, because it's always good to know, what is going on with your health, to always get regular and accurate information around contraceptives, around your HIV status, around STIs, and just being empowered with the accurate information to be able to protect yourself from unintended pregnancies, new HIV infections, as well as STI infections, and just enabling you to be able to enjoy sex in a manner that is pleasurable, but most importantly, safe. Yeah.
All right. I think we can now close this segment on Q&A. And thank you very much, Dolaman and Lisa, for being able to just hold this specific conversation on sexual health and giving the youth a feel of what sexual health and reproductive rights look like based on your various experiences working in the sector, and just various experiences engaging with young people as well. So maybe I can just put together a few notes that we've been able to pick up from this conversation. And it is very clear that good sexual and reproductive health is a state of complete physical, mental, and social well-being as well, in all matters regarding relations and the reproductive system at large. It simply means that young people need to have satisfying sex lives, the capability to reproduce in a very healthy way, and have the freedom to decide if, when, and how they can do so. That has come out very clearly from this conversation. And we all are in agreement that to maintain one's sexual and reproductive health, people need access to accurate information, and as well as safe, effective, affordable, and acceptable interventions, methods, and any kind of choices that are relevant to ensuring that they're safe at all times. All in all of us as stakeholders have the responsibility to inform, empower, and protect the youth and other young people as well, just from sexually transmitted infections, systemic challenges, health-based challenges, and all these kind of challenges as well, to just ensure that they're able to participate in safe spaces and take charge of their decisions and their bodies. With that said, I will continue to emphasize on the need for accessibility, affordability, and meaningful youth participation in spaces. And I hope that the youth are able to take up several spaces wherever they are. That said, ladies and gentlemen, I'm so happy to introduce you to our Diverse Vibes campaign on social media. One, we will be sharing a media kit that you can use to engage young people around sexual health. Please use this to host live sessions. You can host an Instagram live, Twitter space chat, a webinar, anything, just to make sure that we're passing this message to anyone and everyone who needs to hear about this. We also want to invite you to join our next chat on access to sexual health and reproductive rights information, products and services on Thursday, November the 10th at 4 p.m. And we'll be talking to experts about the challenges and innovations around access issues to these important services. For the youth who are asking questions about where they can access this information, access these contraceptives and all this type of things, please be sure to join our chat on the 10th, because that's where you'll get the best answers to this. And you can check the chat for other things that people from my colleagues have, you can check the chat for the kits and links that my colleagues have been able to share on the chat box. So that said, I hope we can all turn on our cameras and take a picture to show that we are part of the Diverse Vibes campaigns and are delighted to have conversations that contribute to the youth participating meaningfully in sexual health and reproductive rights spaces. Ladies and gentlemen, I'm waiting for your cameras to go on. Alex, let us know if we're good to go. So what are we supposed to say? Do we say diverse vibes, or do we say that I'm in charge of my sexual rights? What do we say? Diverse vibes, right? Okay.
Okay,
Seems
nice.
Like everyone is good to go, right?
Yeah.
Victor at Nairobi, I still can't see your camera. Hillary, Mukaka, we want to see your image here. Emmanuel, Mike, Eric, Newton, Laureen, Yusra, James, Asha, Emmanuel, Priscilla, Judith, all of you guys, turn on your videos. Okay, Alex, you're waiting for instructions from you.
Yeah, so okay, so we are going to take it in 3, 2, 1, and smile. You can also make
a pose. We're supposed to say diverse vibes, I thought.
Yeah.
I thought we're supposed to say diverse vibes and, just make sure they're part of all of this. So ladies and gentlemen, in 1, 2, 3. I can't even hear you. All right, ladies and gentlemen, it's been a pleasure to have you on the call and looking forward to see you through the campaign. Thank you very much. Let's keep engaging on social media and be aloof of all our interventions from now going forward. Bye.
Bye-bye. Thank you.